Hi, I'm Jeannie Foley, and I'm here today with Dr. Velazquez-Noll from St. Elizabeth Physicians, and we are going to talk today a little bit about heart disease in Hispanic women. Thank you for coming today.
Thanks for having me, Jeannie.
It's true, I know, for women that heart disease is the #1 killer. Is that the same for the Hispanic women?
Unfortunately, it is. It is also the #1 cause of mortality in Hispanic women is heart disease.
Is there a risk factor or a reason that makes them at a higher risk?
It's thought that the risk factors are similar to that of the general public. However, Hispanic women have a higher incidence of diabetes, unfortunately also have a higher incidence of high blood pressure, high cholesterol, and although we've made great strides, they don't have the same access to health care. There are still barriers to access to health care for the Hispanic women.
Diabetes, that's a pretty big disease. Is there a reason genetically or is it diet related? Why would they be more prone to having diabetes?
Hispanic people in general have a higher incidence of diabetes compared to non-Hispanic people. The reasons are multifactorial. Partly it's genetics, but there's also lifestyle, diet, culture, and again, that key piece that we want to talk about today, which is the access to healthcare still isn't where it needs to be. So maybe they're not getting the screening tests early enough. Maybe they're not finding out what if they have one of those factors to control it.
When we talk about heart disease in the Hispanic woman, I think I just heard you say that men are also at higher risk for developing diabetes. So when you look at men and women in the Hispanic population as a whole, it sounds like it's not just the Hispanic woman that's at greater risk then, it's all Hispanic people. Is that?
That is correct. Yeah, you are correct.
Are there any cultural factors that contribute to heart disease in Hispanic women?
I think women in general tend to be the caretakers for their families. We take care of our spouses, our children, our parents, our grandparents, sometimes grandchildren, and that's no different in the Hispanic woman. Often they are taking care of the entire family. They're working inside the home, working outside the home, taking care of everybody, and often that means they're not taking care to make time for their own health.
What advice do you have for Hispanic women to improve their heart health?
I think the most important thing is to find a primary care physician or provider that you trust so that you can be screened for these risk factors that tend to be very common and so that they can be monitored and treated if needed. Obviously, avoid tobacco products, don't smoke. Try to make time for yourself for exercise. The American Heart Association recommends 30 minutes of regular exercises most days of the week, or 150 minutes total exercise in the week, so that's very important to make time for. Also, try to eat healthy. Try to avoid these overly processed foods that tend to be high in sugar, high in fat, high in sodium, which can lead to hypertension, diabetes, and high cholesterol. So when looking for a primary care doctor, if you don't have access to a doctor that speaks Spanish, it's your right to ask for a translator. Don't let that prevent you from seeking out care.
That's really good to know because I'm sure that's frustrating when you're
Absolutely.
Intimidated and scared about your health.
Absolutely.
And then you can't understand what they're saying.
Yeah.
Thank you, Dr. Velazquez-Noll, for joining us today to discuss this important topic on Hispanic health. To learn more about heart disease in Hispanic women, visit our website.